This is going to start the live recording.
Okay.
So folks, today we have Marcos presenting us on location allocation. It's methodology, a GIS methodology that is quite useful for microplanning, for resource allocation, which can be used in different projects. At Gemini, you probably have heard or are gonna hear about this in the context of snakebite in the Amazon, especially because we want to be able to distribute antivenom in a way that is close to the people that are being bitten by the snakes. But it could be used in many different sources or many different settings. I don't want to spoil a lot of it, but
So thank you, Gemini, for the invitation to talk about the location allocation in Global Intelligence System, or GIS. So we will do a conversation. If someone has any doubt, uh, let me know and ask, or we can discuss on the end of the presentation. So I am Marcos. I am a Gemini member, and I'm a student from UFMA, is a Federal University of Maranhão, located in Brazil. And I work with the Duke groups a long time ago. And so today we will discuss about this research method. And for today, I defined some topics, important topics to understand that method, like what is the network analysis, types of network analysis, location allocation models, how do you perform allocation analysis, and a final example to train what we learned today. I need to talk about some required resources to perform all that analysis. We need specific softwares and license and packages, and I separated here what is the most common. So the most common software to perform the network analysis is the ArcGIS Pro, but with the license, with a specific license that called network analysis extension. But we can also do using the QGIS or also R or Python with specific packages. But spoiler, this is more difficult to perform. But ArcGIS Pro is more intuitive to perform that kind of analysis. But what is network analysis? The network analysis refers to a pool of methods used to model and analyze transportations or utility networks like roads, railways, and all the kind of problems involving movement between 2 points, accessibility, services areas, routing, and optimization of any kind of transportations. And the network is based in the interconnected elements. And the elements are represented with points that we can call junctions. We have junctions and we have the edges that are the lines. And this is the base of to understand the network analysis is based on the connections between the points using the lines. And we can use the network analysis in the real world applications. For example, if you want to study the closest ambulance to any incident, or during urban planning, you want to identify underserved populations, you can use the network analysis for this, or optimize delivery of medications, route, or estimated who lives within 30 minutes of a clinic. So there is real world problems, and we have the network analysis to help to support that application. In conclusion, the network data set is an intelligent model of to study the road system based on the location and the attributes of roads, of the transportation's features. We can relate any other features like the points between the dynamic between any points, or we can use information that affect the travel, like uh, the interruption of the connections with the lines, if I have barriers between the lines or the roads, whatever. That is very complex, and we can charge any information about the roads there. And types of network analysis. We have the closest facility. Here is an example. So if you want to know what is the fire incidents can be reached within 5 minutes of the fire station. So I have a map, I have informations of fire are here in the shell in head, and I want to know what is the fire, what
Marcos,
market. Sorry,
your audio was off for a few minutes, a few seconds. Can you go back a little bit?
here or
You,
before?
y- yeah, the last part that I heard that you were describing that you had the fires and the fire
Okay.
stations, but then your audio was off for a few seconds.
Okay, okay, thank you. So this is an example using the closest facility is a type of network analysis. And here is just an example showing the where is the fire and which fire station it closest to the incident, to the fire, and which fire firework it can reach before. So that this is an example of using closed facility. But if my question is about the coverage, the service cover, I I would use the service area is another kind of network analysis. So in that map, I have the coverage area, and that coverage area changes the color according to the time to reach on that specific area. So in green part, I have closed areas. I don't know here on this example, but maybe we can reach it in 10 minutes. And the yellow part you can reach in 20 minutes. And the red part you can reach in 30 minutes. So I can study the coverage area, but we can use it also the best route on this example, which petrol cars can respond to quickest to the incident. So I have specific roads, and I will see which that road fit better with I want to do. Which of the road is better to explain my problem, resolve my problem. So I have many applications here. And the last type of network analysis is the location allocation. The location allocation will respond where should we open a health service, for example, to maximize market share. So I have a pool of services, but I will choose which service is more strategy to, to provide specific service. So I will not choose every services, but one or two services to solve my problem. And this is based on the demand population and of course on the transportation network. So because of this, location locations can help find the best location for facilities to serve a set of demand location, a demand population. The location may be trying to cover the most amount of demands. In other words, I can say the best location is based where I have more demand. So I will locate uh, a business, a health service, a fire station, um, a store, I don't know, where I have a demand for that service. And the location allocation is based on this. Of course, minimizing costs to reach on demand or maximize market share. And after to perform the location, it's possible to create the services areas surrounding all the population that I am serving on that allocation. That I can provide the services to surround the areas so that all demand is met. It's possible to see, is a visual way to see the location working. And location allocation can solve models references the network data set to determine the costs or distance metrics of shortest paths between facility and demand locations. So to connect that point between the demand and the facility points will depend of the distance, of the time, of the cost between that transportation. And the location can study this to give the less cost, the less distance, the less time to connect each point. So that is the parameters that we use for the location to find the best set of locations to which the demand will be allocated. So the following slides will perform allocation model, divided in 4 steps to we understand better. So the first step is upload the transportation network. The transportation network usually are represented by lines like roads, trails, ferry boat, railway, and we have some public data set that we can find that information. One classic example are the OpenStreetMap. We have information about roads of everywhere, every world. We have information there. But I think Google Maps also we can take that lines, that shape files of lines on there. And we have other kind of transportation network, or other example like rivers, and we can find the rivers data set on Hydroshed is a public data set also, and we can download from there the informations of the rivers or any kind of transportation network routable we can use here. The logic is we have lines to connect, and lines represent the real uh, and the current transportation of the people on that specific area. Here is just example, the first map with the lines in red represent the roads on the Amazon region and on the Amazon state in Brazil. The another one in green line represent the streets in another state in Brazil, it's called Maranhão. And here is an island with rivers. Here are rivers from the hydroshed. The second step is define what are the demand points. Where are the demand points? So the demand points will be represented by points or polygons contain the population count. Will be country is a state, municipality, or the population distributed on the space. I don't know. I just specify that are the demand. In our group, the Gemini, we like to use the word pop. This word pop is a public source data set that uses the satellite estimated population with the symmetric population that we can see all the population distribution in the spatial area, and we can see the density of the population in the space. So we use that because we know the population are in different areas. Like we have more population on the near of the sea or near of the big cities, and few in remote areas. I don't know. And just specify the demand points, and usually he are represented by points. And we have also the supply points. The supply points refers to health facilities geolocated. Here will be hospitals, community health centers, laboratories, stores, fire stations. I don't know what makes sense for your problem will be the health facility where the services will be allocated. And I need, usually here are points also, but I need the correct geolocated georeference to locate it better my facility. And the last step will be the definition problem type. So I have different algorithms to solve my problem, and each type of algorithms will solve the problem with different way. But the logic is the services are provided by a facility and the demand for the service. So I depend of the dynamic between the facility and the demand to allocate it to one or more facility. This is a summary of any type of solutions, the purpose of each one, and just an example using a health problem. So, for example, if I wanted to minimize impedance, I can place clinics to reduce the average time per patient. Here, I need to specify what is impedance. Usually are the distance and the specific distance or a specific time, but I can maximize coverage that can select emergency care units that cover the most people within 50 minutes, or I could use maximize capacitated coverage, or maximize attendance, or market share, or target market share. They are very similar, but discrete difference between any others, and it depends of the kind of your problem you want to solve. So now I will show an example to a problem and construction a solution, building a solution using location-allocation and other kind of network analysis. So the problem I call therapeutic itinerary for stroke. This is the name of the problem. And the problem consists in the leading cause of deaths in Brazil, and specifically in Maranhão. Maranhão is a state in Brazil located on the northeast. And the leading cause of death are acute myocardial infarction and strokes, cardiovascular disease, as in all the places in the world. But in Maranhão, we have is that Maranhão is the poorest state in Brazil and has a extension area similar to the Italy. And the problem here is because the acute treatment for stroke and also to myocardial infarction consists in the use of a medication called thrombolytics. And I need a specific time to infuse the medication, the thrombolytic, on the patients. And for stroke specifically, I have a time window of 4.5 hours to do that medication. But that service to do the thrombolytic are available only on the capital. And the capital is called São Luís, is on the north of the state. So if we think here it has the same area of the Italy, and we have a north region, of course, the time to transportation to the city, to the capital, will be more than 4.5 hours. And that is a problem. A lot of patients don't receive the acute treatment for stroke. And the treatment is decentralized because only in São Luís we have that information here on the red point. And the question is, what are the best strategy services to allocate considering the population demand for thrombolytic treatment within 4.5 hours? So I want to know which other services on the state can I give the best acute treatment for stroke in that specific time, 4.5 hours. To solve that problem, I use the ArcGIS Pro with the networking license, and I use secondary data, usually open source and public data set, like information about the hospitals in Maranhão. In Portuguese is Quinés. We use information about census, the IBGE. We use the OpenStreetMap for the roads, the streets, and for the main points, the population. I use the world pop. But I also use the primary data about the resource from each services. So I ask for the Secretary of Health which services in Maranhão has a specific type of treatment or a specific equipment that I need to for the treatment of stroke. For example, uh, a cranial tomography, CT, the CT scan. I need to know where I have CT scan on Maranhão, for example. My theoretical model is the following. I have a health district. In Maranhão, we have three health districts. Is aggregation of cities that can use the same network of healthcare. The Brazil, all the Brazil are divided in regions of health, and here I will call health district. And I have the demand, the population, and that population need the treatment of stroke in 4.5 hours. But this is for specific for stroke. To I perform the thrombolysis, the thrombolytic treatment, I need to do a CT scan before. And I need the patient reach the hospital with CT on that time. The problem is the hospitals in Maranhão with CT scan are not open for the patient, the population. Because here we use that term open door, is an open door hospital. That is not an open door hospital, it's a closed door hospital. That is not, I don't know in English the expression, but it's not a hospital free access to the patient. Only reference patients can go there. So because of this, the patients need to go before to admit in the hospital. It's an open door hospital that can receive everyone. And after be analyzed by a doctor there on the admitted hospital, if they are suspected of stroke, I can send the patient to the hospital with CT. So again, the time to infuse the thrombolytic is 4.5 hours. And I need to do the patients go to the admitted hospital in less time, of course. So I specify is a random time. It's not based on literature, that time. I specify 2 hours. So again, the demand population will go first to admitted hospital and will be is his patient suspect of stroke? Yes, I will send to the hospital within CT scan, and all that flow need to be occur in 4.5 hours to receive the correct treatment. After the thrombolysis, the patients need specific care. Sometimes they will need hemodynamic treatment that's called thrombectomy, and I can do that in 6 hours of the onset of symptoms, or neurological ICU, intensive care unit, where I have a neurosurgery, neurologist, or a specific professional treatment, rehabilitations, whatever. I need to send the patients to another services. So this is my theoretical model, and I will can resolve this using the network analysis. To the first point, the first step is upload the street and road from Maranhão. I use the OpenStreetMap to clip only the streets on Maranhão. And here is very important. I need a variable that I will call distance time is the time you spend to use that specific street. So, for example, how many time I use it to across to through all that avenue or specific street, the time I spend to run all the distance of the street. We don't have that information on the OpenStreetMap. So I need to transformation data. So I use the length, I have that information there, the length in kilometers, and I divided by the velocity of the street. I have also that information there. So using that equation, I can create the distance time. Based on the distance time, I can create the network data set. I led a tutorial on the end of this presentation to how to perform a network data set. We have specific steps are not difficult, but the most important is have that variable distance time. After build the network data set, we can see on the properties, we have the number of edges and represent the lines, and the number of junctions that represent the connections between the edges. So if I have that, usually are a large number, and we can see on the end if it is working. João, do you want to say?
Yes, Marcos, can you tell us what are the edges and the junctions? Are they streets? Are they, stop signs? Do you know that?
Yeah, edges represent the lines that here will be the streets and the roads, and the junctions are like is not the stop, but represent where I finish one street and I begin one another one street. Is the
Got it.
connection between the streets are not specifically stops, but where I have a line and begin another line.
Okay.
Did you understand? Yes.
Yes, thank you.
So that represent. So working uh, network will have edges and junctions. The second step is upload the current hospital location, and I took on the KINES. Uh, I have the 230 admitted hospital in Maranhão. Is the open door hospital, and I have the CT scan hospitals. I have 22 hospitals on Maranhão. Are the hospitals not open doors and just reference hospitals? And I have neurological ICU units. We have a few in Maranhão, only 6. And the next step is upload this medical population I took from the World Pop and create a 15 kilometers square hexagonal selection. What is this? So let's concentrate on the first two images, figures. Here in green, I don't know if you can see is lighted green. I have the population density. Of course, I have more density on the capital, where I have more than 1 million people living here. But I can see all the distribution of the population on the space on the map. But that population, I need to create points here, points that will connect to the facility. And how to do that? We use a method uh, that was validated before, and I create specific polygons that are hexagonals. I use that hexagonal to count all the population inside each hexagonal. And then the hexagonal has a specific size, 50 kilometers square. And I count the numbers of people living in each hexagon. For example, here on that inset figure, I have more. I have blue more is stronger because I have more people living here. And after this, I will do a centroid, create a centroid point in each hexagon, and that will be my reference point of the demand. So I transform that is very random areas with population to create more located points to use on my network analysis. And this is the final map on Maranhão using the demand points using that method. If you see, are very similar to another others. And the colors change according to where I have more or less people. I don't know if it's clear or if someone has doubts, but
No, I
is
think
that
it's clear. The only thing that we would just to remind everyone is that the demand here are people, are the cases or like people in that are in need. In this case, we are using patients, we're using
yeah,
population, but it
yeah,
could be customers, it could be, like a I don't know, supply
yeah,
chain, it could be other things, but we're talking about people here.
yeah, yeah, perfect. When I took that
Yeah,
data,
sorry.
sorry, Timothy.
Yeah, sorry, I have a question here. Is there a difference if somebody choose another figure rather than a hexagon, like pentagon, to choose population? Is there maybe the other one which is more accurate or less accurate?
Okay, okay,
Is there a
I got
difference?
him. Yeah, I got a good question. So the first point that João said, I used here all the population, where the population lives. And in Maranhão here was about 5 millions of people living. And I have it here on that map all the population. But I can base that analysis only in cases. For example, only cases of specific disease or specific conditions. I can also do that. But I think stroke or myocardial infarction will be represented in adult population, in elderly people. So because of this, I used all the population. And about the type of polygons that Timothy comment, we used the hexagon because the hexagon can fit better on the frontier areas. So if you can see here, I can fit better the figure on the if for example I use a square or circle, I will have areas that will not match, will don't fit it specifically on the area.
Yeah, they don't
I don't know if
overlap, right?
yeah, yeah,
Like if you have
and
two circles, they would have an area that is not covered by the population. Yeah, I see.
exactly, exactly is that, and the hexagonal is specific that. So it seems like a bigger, a larger, uh, 15 kilometers square, but it represents only 13 kilometers of radius. It's only that.
Mm,
It's not so much, but the area are 50 kilometers. But okay, in some areas we don't have hexagonals because we don't have populations living here. Are empty places, and I don't know, forest and areas that don't live anyone. And so because of this, I don't have population or demand. So after this, after I upload all the data set, I will start the network analysis. And I will click on the button about the network data set. And I can see if I am using the correct network data set I created before. This is very important because they can change this sometimes. And I will select what kind of network analysis I want to do, like service area, road, closest facility, location. And here we will use the location allocation. When we click on the location, we will open a specific menu with some options, okay? And that options are the import facility and import demand points. I imported the facilities, and I can choose between candidate facility is the potential facilities to receive that services, or I can use the required facility. We can use the both at the same time. Required facility represent the services that already offers that service. In that example, I have some services that use thrombolytic treatment for stroke. I already have, but only in São Luís. But I have other kind of services in Maranhão that can be candidate to receive that treatment. So the first location allocation, I use it as facility, the CT scan hospital, where on my theoretical model, I will locate the thrombolytic treatment. The another point is upload the demand points. And here I will use the centroid of population that I calculated using the selection. Sometimes I will see a message warning that some features are located out. What it represents? Sometimes I have people living so distance from any piece of the network analysis. For example, people living in a remote community, indigenous community, very far from any street, any road, and that people, unfortunately, can be located. They will be far away from the network. And is that what they are saying? There are features that are not located. Sometimes that is very common to warm, but I don't know, depends what are you working, what are you doing. There is some ways to correct this, like to approximate the points to the network, but I can change your data. So that depends of your what you are you studying. Here I assumed that is okay. Some people don't be allocated. After this, I will set some parameters and define the type of the problem. And here on the menu, I will specify I want toward facility. The another option is away from facility. So is the direction I want. It's like I want the demand go to the hospital, to the facility, or the hospital or facility go to the demand. Depends of what are you studying. Here we are talking about the hospital, and I need the people go to the facility. So to watch facility. I set the time, so I use it 4.5 time hour. So I need to specify. I wanted to work with hours, but another possibility is work with kilometers. I don't know. I specify the number of facility I want to study. It's like I want you located 10 facility or 20 facility. I don't know. You will specify the number, and I will specify the type of problem. And here the best algorithm I thought was maximize attendance. This is the result of the model, the final result, what it represents. And that orange star represents the services located, the best strategic services, then give me the best coverage area. And the orange lines here we have closed I have the connections between the demand points to that service. So I can see where each demand need to go to the facility. What is the responsibility for that facility according to the demand? So I know, for example, in some city, my reference hospital will be that. That is very interesting because I give responsibility for that facility and I can allocate the population here. But how to know what is the best numbers of facility to allocate it? For example, here I specify 10, but I could specify another number. It depends of what do you want to do. For example, if the government of Maranhão said, so I just have money to implement 5 facilities, okay, I can choose only 5 facilities. I change here 10 for 5, and I will choose the best strategic 5 services. So it depends of what do you have. But in our group, we are using another methodology to discover the optimal number of facility to implement. We use a point. Plateau point. That plateau point represents a number that if I increase that number of facility, I don't have a stronger. I will don't represent a significant increase in the population coverage. For example, here on our example, the optimal number was 7 services. Because if I put 10 or 15 or 20 services, I don't increase the population coverage. So here with 7, I have less resources, is easy to implement that services, and I can give a better population coverage. And here are more than 98% of the population in Maranhão are covered only with 7 services. And I can study also the mean time of transportations in hours. I use the lines, that orange lines, and I can calculate the distribution of time to this location. And here I have each demand point, the mean of transportation are 1.7 hours to this location, to transport to the facility. That is good because time is crucial to stroke treatment. And I can allocate the people less time than 4.5 hours. That is very good. So we resolved that problem. We solved that problem. The demand population to the hospital with CT, I resolved 7 services with about 98% of population coverage, and I can resolve that problem. But as I said, I don't have a direct connection between the 2 points. I need to intermediate step using the admitting hospital to the hospital CT. So what I thought, I have the best strategy services with a hospital with CT. Now I need to know which admitting hospital are located in 2 hours to the hospital CT. And that will be my reference to admitting hospital. And I uploaded the admitted hospital. Here I will call facility. And my demand point will be CT scan hospital chosen, not all the hospital, but just the 7 hospital I defined it on the analysis before. And here I have the following. One admitted hospital can send the patient for more than 1 service. I don't need only 1 facility, only 1 CT scan hospital. In admitted hospital, like for example, under emergency, I have options to send the patients. Because of this, I changed the algorithm and I use the maximize market share that I can choose 1 or more facility to send the patients. That was my definition of type problem. And here I can allocate 100 admitted hospitals that are located in 2 hours of one or more facility, and they can share and connect the admitted hospital to reference hospital with CT scan. I also studied the route between admitted hospital using the closest facility, another type of network analysis. And I could study what is the best street or transportation, for example, to call to ambulance. Oh, you need to go to that way, not that way, because this is closest, this is more more easily to come to the facility, to the CT scan. And for the admitting hospital, I used the service area to study the coverage population of each admitting hospital. And we can see they could take a lot of places in Maranhão, and they can study people living in 30 minutes, in 1 hour, in 2 hours. And here on the map, each time for the service area are represented by different nuances of color of the brown. In the clear area, I have the people living in 30 minutes to the hospital. In the secondary color of the brown, I have 1 hour. In the darkest color, I have the 2 hours to reach the admitted hospital. So I can see the coverage population if that service to admit in the hospital can solve my problem of dislocation, or I need more hospitals. I don't know. That represent the all the service, the surface of the service area for admitted hospital. And to finish our analysis, I need to send the patients for the neurological ICU to tertiary service with neurosurgeons, specializes, rehabilitations. So I don't have a specific time, but I can create the best route to reach that services. And I studied all the routes to connect the CT scan hospital to the final hospital to finish all my treatment of the patient and finalize the therapeutic itinerary for stroke. And all that analysis we are using for a program in Maranhão of the government of the Maranhão that is called Stroke Program. Em português, Programa AVC. Cada segundo importa. It could be translated like each second matters. So we are using that analysis to expand the services. What services will provide the thrombolytics and give the best for the population. In conclusion, location-allocation can be used to solve time-sensitive problems. We can use a public dataset as I use it, and they are available and can support complex analysis. But before we implement the results, they need to be interpreted carefully before the real-world application. For example, I selected a place that I don't have the required number of beds to receive the patients. I don't have monitorization. I don't have the CT scan are broken. So here is a theoretical mode, but I need to dialogue with the reality before implementation of that. And the cost of some softwares like ArcGIS Pro may be a limiting factor because ArcGIS are expensive. But we have some institutions that can provide that software. But we can use open source software like R or Python also. So there are some reference how to create a network data set. You choose the best location with location. That tutorials are easily to read, and I highly recommend that. And thank you, everybody. Any doubts?
That's great, Marcus. Thank you. It's really cool how you showed us the complexity of the problem by first going through the direct way of 4 hour distance to the city hospital, sorry, to the city hospital and to the thrombolytic treatment, then talking about how this health system has, of course, in Maranhão is gonna be you gotta go to the open door and then to the closed door facility. It's really cool how you were able to map the real world problem into your theoretical framework as well. That's really interesting. Um, you talked about the problem with the license and how ArcGIS can be expensive and not all the facilities or the institutions would have access. But I wonder, is this something that you see that would be used by the policymakers, or would you also have think about this like this software or these solutions to be used by the lower level decision makers as well at the municipality level, at the at the institution level? What do you think? Is this something that needs to be accessible by everyone, or would you think that this could be, at least in terms of reducing costs, would be at a higher level of organization?
Hmm, I don't know. I, do you? I don't know if I understand. Are you asking if that kind of analysis needed to be concentrated to some people, not available for everyone?
No, what I mean is like, for instance, you did all of this analysis, and let's say you're
Okay.
going to bring this up and make this available at the Ministry of Health, at at the
Okay.
state health department or something. That's okay in a sense because then you are paying for the license for only that
Okay.
institution. But then, do you think that this would be necessary or need to be make available for the general public? Yeah, by general public, I mean the policymakers at the smaller
Hmm.
level, at the municipality, at the health facility level, basically thinking about making this data analysis, this report available for other people that even could try to do their
Hmm.
own changes in the system.
So I think it's not have only have the software need specific people to perform,
Mm,
and the spatial analysis are not um, so popular between the health workers.
mm.
Sometimes geographies, geography,
Yeah,
people that
geographer, yeah.
yeah, the geographies use more. But
Mm-hmm.
I here the government don't pay that license of the
Mm,
GIS. Only the universities pay.
okay,
But I think that is a possibility to show that important has that on the protocols.
I see.
I, I, I'm working on another protocol is about the myocardial infarction,
Uh-huh.
and in the I'm using also the location allocation because another problem we don't have thrombolytic for the stroke, but we don't have thrombolytic for heart attack for the myocardial infarction, and I am locating the different sets. The difference is for the myocardial infarction, I has less time to do the thrombolytics, and I
Mm-hmm.
need more services. So the challenges are different, and I don't need the CT scan. I can use the thrombolytic on the admitting hospital. Are different, but I mean I work on the government here, and I'm talking with the secretary to implement that services to and see if I can have better outcomes on the population, less deaths or hospitalizations, and perform more treatments, acute treatments. But the difficult are they are government, they are healthy managers, and they
Mm-hmm.
will see the cost of implementation of the services and the policies. We have a political setting here very difficult to change. For
Mm-hmm.
example, I located one services in a municipality that the governor don't talk with the manager from there. O governador
Okay.
não fala com o prefeito.
The governor doesn't have relationships with the mayor,
Yeah,
so yeah,
and that is a kind of problem that the research don't
and
are
result.
prepared for this.
Yeah.
And so I have a theoretical model, and I give the theoretical model for the who are writing the protocol. And so that is my work, and do whatever you want to do. But that is my recommendation. So is that
I
is
see.
are difficult. The operalization are the hardest part. I think this.
I see. I see. Yeah. That's great. We are at time, folks. Thank you, Marcos, for coming. If you have other questions, let's try to get Marcos some messages via Teams or via email. I'm sure that he'll be glad to give you some material to look at.
Mhm.
But I'm sure that this is going to be a very good recording for people to come back and to look at when they want to do the step analysis.
Yeah.
Thank you, really.
William, sorry, William asked how long to take the data preparation.
Mm,
For that specific analysis, I spend more time thinking about the theoretical model because I need went to the literature to see the time, the specific time, and download all the data set and create the network analysis. To perform the location allocation, uh, spend about 10 minutes, are very fast.
mm,
But I'm working, as João said on the beginning of the presentation, I'm working on the Amazon region using antivenom. In there, I have more connections because we are working with rivers, and each analysis spend about 30 or 1 hour. So if I change one facility, I can locate one more facility. I will spend 1 hour to run everything again, and
yeah.
depends of the size of your data set. But I don't think that this spend so much time because it's very complex, and is
Hmm.
that
Yep. All right. Thank you all for coming. Thank you, Marcos, again for presenting. And we will see each other again next week.
okay? Bye bye.